The only harm that's coming to my friends or the people that I care about that are trans is transphobia.
17-year-old Xander lives with his family near the coast in North San Diego County. His father's a retired Navy officer, and Xander is covered by military health insurance, Tricare. Xander is trans. For his family's safety, he asked we only use his first name. Even without coverage for gender-affirming healthcare, his mother, Robin, says she thinks they can absorb the added cost, but she's worried that thousands of military families can't.
It's going to be hard. They're going to have a child in distress. They're going to have a really unhappy child. And I don't know, my heart breaks. I'm very worried. I'm very worried that there are kids that are going to be physically harmed because of this.
The federal provision echoes laws in 26 states that ban gender-affirming care for children and teenagers. Republican Congressman Doug LaMalfa of California spoke in favor of the provision from the House floor.
Children should have the chance to grow up without being subjected to experimental procedures that can cause permanent damage to their bodies and futures. These are minors we're talking about here. And what business is it of the Department of Defense to be engaging in this?
But the claim that this gender-affirming treatment is harmful is rejected by every major medical organization. Kathy Molig is the founder and director of Trans Family Support Services, a San Diego-based nonprofit. She says trans kids receive counseling and mental health care well before doctors prescribe any medication.
This has been approved care by the medical associations, by the pediatric associations, by the psychological associations as important medical care for gender dysphoria. And so when we withhold medical care from anybody, we are creating harm.
San Diego Democratic Representative Sarah Jacobs serves on the House Armed Services Committee. She says the anti-trans provision wasn't in the version of the bill that their committee negotiated. She voted against the defense budget, even though some of her priorities, like a military pay raise, were included in it.
I can tell you our military families are not calling me about drag shows. They're not calling me about these culture war issues. They're calling me about the housing they need, the childcare they need, the healthcare they need to keep themselves and their families safe.
Xander, the 17-year-old, says lawmakers should start listening to trans kids.
A lot of my friends and like a lot of the people that I've talked to who are trans, they have felt so much happier after transitioning.
He says his transition via the military healthcare coverage he's about to lose was a revelation.
Because a lot of people think that it's gender dysphoria that defines being trans, but a lot of times it's like gender euphoria, as in like they don't know that it's an option, but when it does become an option, it's like, whoa, this is so much better. It's almost like putting on glasses if you have like really blurry vision or something like that to me.
Xander's mother, Robin, says the coverage ban is especially cruel because military kids have to move, change schools, and make new friends every few years.
They're called dependents, but I think they're the bravest of all because they're making a sacrifice that they didn't choose to make. And now their country is turning their back on them. It hurts.
Republicans in the House this summer failed in a broader effort to strip insurance coverage for gender-affirming care for everyone covered by Tricare, including troops and military retirees. Advocates are preparing for more anti-trans proposals to emerge from the Trump administration. Andrew Dyer, KPBS News.